go.
Okay.
All right, so this is a picture of one of my patient's broken jaws, and the reason that this is kind of an interesting photo. This is like a little, like 3-pound Yorkie, really tiny little dog. But this is the end of her root of that tooth, and this is the outside world.
Right.
So little dogs are kind of set up for failure, unfortunately for them, because they just genetically speaking have a tiny amount of jawbone but these giant teeth. Versus like a Labrador, they have little tiny teeth and a ton of jawbone. And so they really are, the big dogs are kind of just set up for more success than these little guys. And so imagine if this tooth were to become abscessed, this is a puppy, but if it were to become abscessed, the abscess usually is almost like a little popsicle stick at the end of the root. And so imagine if she had this here, it would be literally hardly anything holding this jaw. This bright white part of the jaw, the ventral cortex of the mandible, that's one of the strongest pieces of bone as far as the jaw goes. So, but with that being said, this tooth kind of goes into that part, and then if there's an abscess, there really is nowhere for the abscess to go, other than, like they were saying, a lot of times they will jump off the couch, their feet slip, they hit their jaw, and like that's enough. And normally, like a normal dog that doesn't have dental disease, they wouldn't think twice about it. It'd be fine, But these guys, you almost look at them funny, or they chew on something hard. There it goes,
Right.
So it is a tough spot for them to be in because of this particular tooth, and that seems like the same area that's fractured for him is almost right in the same spot, actually.
Okay, where? No, where is it?
So this is where the break is. So this part is supposed to be attached to this part.
No, I'm trying to picture it in his mouth.
Yeah, so this is right here.
Okay.
So right in between these two roots.
Oh, wow, it's right in the back.
Yep, so right here, and this big tooth is this tooth, and you can see how big it is even on the model compared to the one in front of it, and so it is a much larger tooth. It comprises the majority of, especially small dogs, their jawbone, and so it doesn't take much for that tooth. This is like a very common place that they break their jaw because of just how they're made, unfortunately, So for her, we did, it depends on what his teeth, so a lot of jaw fractures, we get the imaging, we see what the x-rays look like, and then we kind of decide how to fix it. So there's multiple different ways to fix it, and sometimes because of how chronic it is, there's a blood vessel and neurovascular bundle that run through this kind of dark gray spot, and that's the mandibular canal, and so it's a hollow area of the mandible where all the blood and vessels run to supply all the soft tissue and bone and teeth that are in the mouth. Well, a lot of times when they break their jaw like this, that breaks, so they lose that, they don't have a good connection anymore, and so the blood supply to that area isn't as good as it was originally, and so it is not, it's pretty common that we'll get what we call a fibrous union instead of a bone-to-bone healing, especially on guys like him, just because the chronic nature of how long this has been going on. So we don't even know how long it's been going on either.
I know it's been going on at least 10 months.
Right, and who knows how long before you got him, And so because of that, a lot of times the bone ends are almost like rounded instead of like having a sharp edge to them because they've just been rubbing together for a year or however long, and so it doesn't have a good blood supply. So what we need to do most likely is extract this tooth, and it sounds like they already took out this tooth from one of his previous vets that he went to. So we really need to get this tooth out because that is probably the reason that it's not healing.
Oh, okay.
And so it's because this tooth is infected, because usually the root of this tooth is involved in the fracture. And in teeth, in dog teeth especially, all the blood supply comes in at the very bottom of this tooth. So pull up another. So this is kind of a schematic drawing of a canine tooth, but all their teeth are the same way.
Can I do, let me see.
Absolutely.
Am I doing that right?
That way. I think the other way. There you go.
There we go.
That way you can see it.
Okay.
So all the blood supply comes in through the apex of the tooth, which is the deepest part in the bone of the tooth. And so if there's no bone around that, or no blood supply, or the tooth even gets moved a little bit, it's enough to lose that blood supply, because all these little bits right here are the blood supply, and that's it.
I see.
So if that part fractures, then there's no blood supply, and the tooth will die, and then it becomes infected, because 100% of the time, if a tooth doesn't have blood supply or it dies itself, then it's going to get infected.
I see.
So that's probably what's making this not heal, is because it's just chronically infected. So
oh man, he's been sick all this time. I've had him on antibiotics.
and it's kind of a band-aid on the issue. It's not
Right.
really going to fix it until we get that tooth out or do a root canal. But with him, I would say extract it most likely. We'll determine that obviously once he's under anesthesia and can get an image of him. But at least we'll know something needs to be done with this tooth, or we're never going to get it to heal. And so we'll get this tooth most likely taken out. We'll kind of see how things look once we have him under anesthesia. But a couple different methods for us to fix are something called an acrylic splint. And so it kind of, this is an upside down picture, but this is the splint here. It's kind of this bite guard type material. And then there's wires underneath it that we put kind of through around the teeth as well. And so like x-ray wise, it looks like this. So these are the wires around it. And then this is the splint that we use to hold the splint in place. So I don't know if he'll be a candidate because really we need to have at least 1 or 2 teeth behind this tooth. They're usually not big teeth, and we don't know if he even has them or what they look like. So if those teeth aren't there, then that's not a good option either. We may have to do something like this where we put wires in to kind of hold those 2 pieces together. Which this one is one of this chronic. You can see this is kind of a rounded edge. Like they're not like that other x-ray where it's a nice sharp edge. They're nice and rounded. So this is a chronic fracture that we were trying to put together. So what will happen sometimes with these is they don't heal. Like it won't be like bone to bone healing. Like it won't look like a solid piece of bone. It'll look like this, but it will be nice and stable because it's kind of formed a bunch of fibrous tissue around it, kind of like a joint. So it will have a little motion, but nothing like what he has now. And honestly, even with that, as long as we can get all those teeth taken, address the teeth that are around this, he will be a happy camper. Even with the fibrous union, he will be like a new dog.
Really?
Yes.
Okay, great.
So it's a good solution for him, especially because how chronic this has been. Like we don't even know how long.
Time.
Right. So
somebody told me, well, it's been broke that long, it's not going to hurt.
No, it's very, no. Clearly you saw he was not a fan of me looking there. And he was such a good boy for letting me take a look too. So that's an option. And then another option we will do sometimes, depending on the patient, is we'll put these buttons on them. So there's a button under the chin and there's a button on either side of them. And they're all connected with a suture. So if you've heard of people when they break their jaw, they like wire their jaw shut. It's similar to that, but he's able to open his mouth and lap up food and water, just not fully open it. And so it really limits the motion on that area, and then it lets it kind of heal because it's really not moving as much as it would be if he could open his mouth fully.
So it would heal naturally.
Correct.
Oh, okay.
Correct. So we just have to kind of see what he's a candidate for, to see what he's got in there for us to fix it. You know, so sometimes you have to get a little creative with jaw fractures because none of the situations may be ideal to fix it, but we need to find the most ideal for what he has going on. You know,
what is the normal price for all these?
It depends. So sometimes it's on the lower thousands, sometimes it's on the higher thousands because we'll address everything going on in his mouth at the same time.
Because see, I need an estimate to give to them so they know how to get the money. You know?
We'll give you an estimate. It'll have a range on it. We don't 100% know. The biggest question mark is what do we need to do to his other teeth? Because you know we really haven't done he hasn't had any dental x-rays, and so you know, does he have other teeth that are abscessed as well? Does the other side look like that one did, you know, and we need to get it before it breaks, or you know, we just don't know. The good news is the rest of his mouth really doesn't look that bad, so fingers crossed. I mean, sometimes they can be deceiving, they can look okay, but then we get x-rays and we're like, just kidding, they're not okay. And the other times we're like, yes, they're okay, we don't have to do anything. So if we have to just fix that fracture and address the tooth around there, I will be just as happy as you because we want to just, you know, do whatever he needs to. If he can keep his teeth, we'll be great with that, you know. But I just want to set him up to where he's comfortable and happy and doesn't have any infections and isn't in pain. That's really my goal at the end of the day. Whatever it takes to get us there, we'll figure it out, you know.
Yeah, I appreciate that.
So how it normally works is we'll get you a ballpark estimate as best we can. And I usually try to err on the high side with the estimate, to be honest, because at least if it is the higher end, the day of the procedure, everyone kind of expected it, and it's to be expected. But if it's not and it's less, everyone's always happy.
Yeah,
you know?
of course.
So at least, you know, we'd rather overestimate and be less than underestimate and it's more. That's never my goal. So it's just a kind of a guessing game at this point because we really can't get a great look just because he is uncomfortable.
Right.
So it is hard to tell for sure.
Does he need to be on antibiotics? Because you did say he's got an infection.
It wouldn't hurt to make him a little more comfortable actually to do that. So, so that's one option. There's the buttons, the wire, and then the splint are kind of the most common things that we would do to fix it.
Okay.
We don't typically like to use plates on dogs if we can avoid it. Only because they have so many roots and they don't have a lot of jawbone to place that. So we can't really put a plate where this gray line is because that's where all the blood supply and the nerve are. We can't put it through there. We also can't put it where these roots are. And you can see, even on this dog, there's a root right next to that tooth. There's that one, that one, that one. There's really not much wiggle room. And you can't put the screws through the roots because otherwise you're going to kill that tooth and it's chronic pain.
And you did see his root was exposed, which is not good. It's got to hurt.
It is 100% painful, yes.
Poor baby.
I know it. I hate it for him too.
Yeah.
So the plates aren't really a great solution most of the time. They've come up with some new plates that are smaller and maybe...
Oh, it must be that light.
Is that better?
Okay. Yeah, that's better. Thank you.
Yeah, no problem. So some plates you can still use, but it depends on the situation. So we'll kind of wait and see what things look like. We try to not use them if at all possible, just because of the challenges based on they don't have a lot of bone, the teeth are in the way, the nerves, blood supply are in the way. So we try to come up with other methods to make it heal that way. So. And sometimes we'll take the tooth out, and he doesn't really have a good nose, but like a normal, not one with a smush nose.
He had his mouth wide open. I said, that would have been a good one.
Exactly. Sometimes we'll take out the bad tooth, and there may not be a whole lot we can do other than close the soft tissue and then put them in a little muzzle big enough that they can still eat and drink with it on. And then that may be our best option too. So we kind of play it by ear depending on what we can get away with. But if we can get that tooth out, he will feel a ton better, I'm sure. So.
Now, him being on Apoquel, will that, I might have to keep, he has such an itching problem. I have to, I changed his food. I did everything I could, Is that going to cause a problem? No.
Should be totally fine. Yeah, he can
good.
stay on his Apoquel. That makes him less itchy and happy. We're good to go.
Yeah. Okay,
so
great.
no problem there.
Okay, and how long does he have, is he going to be just one day in here?
It's an outpatient procedure, so usually we'll do the day of the procedure, we'll ask if it sounds like you're from not close anyway, so you'll probably kind of hang out in this area versus going all the way home, and a lot of people do that, honestly, so so usually what we'll do is we'll see if you can wait around for about an hour when you bring him in. That'll give us time to get him ready for surgery, under anesthesia, do the dental x-rays, do the oral exam. We also do a cone beam CT on all of our patients, and so basically it's just giving us a three-dimensional image of his whole skull, so from his nose to his neck area, and just that way we can see everything we need to see. So we're going to see that jaw fracture really well. We're going to make sure nothing else is infected or abscessed. It's just a lot more sensitive of a test than an x-ray. So we just get a lot more information from it. So we do that on all of our patients, so he'll get that as well. So once we get the CT, we'll do dental x-rays, and we'll do my oral exam, and I'll know exactly what we need to do. I'll come up and talk to you. If it's something that you're interested in and you're okay seeing him under anesthesia, we can bring you back. I can show you what's going on in his mouth. I can show you the CT. I can show you
so it's going to be twice.
Nope, just one procedure.
No, I thought I heard, maybe I misunderstood.
No, you're good.
You said I bring him in that day and stick around an hour.
Correct.
And then you're going to do the x-rays and if I'm okay with it, then just leave him, correct?
Well,
and he gets done.
Yeah, I'll go over everything with you while he's under anesthesia. Usually the girls are working on cleaning the other teeth or whatever needs to be done while I'm talking to you. It's a pretty quick conversation, but at least that way you can kind of see what's going on. And then whether I bring x-rays and stuff to you or you're okay coming back and I'll show you on him and on the imaging and everything while he's under anesthesia.
Okay. But it is just one time. Okay,
correct,
great.
Correct.
I got it.
Yes. Unless there's an implant we put in like those wires or something, then we may need to see him back for a recheck and to take them out potentially.
Okay.
But if we're able to do it in one procedure, then that's great too, so so we'll play it by ear that day of the procedure. But once we kind of go over the x-rays and what's going on, then we'll adjust the estimate to make sure that that's as accurate as possible. And the goal is to fall within the range we give you today, and so hopefully that's the case. And then once the second estimate, the day of the procedure, is given to you, we won't go over that estimate. So it'll be that. If there anything changes, like I find something else while we're working and I'm like, we probably should do something with that, I'll let you know, but that's pretty rare. Usually we have all the information we need. So it should be within that second estimate that we give you, which hopefully will still fall within the one we give you today. Does that make sense?
Okay.
Okay.
That's great. So right now you want to put him on pain medicine and maybe an antibiotic. If it's affected, he does need an antibiotic, doesn't he?
Correct. Okay. Yeah, so it wouldn't hurt to do the antibiotic, just if nothing else, to make him feel better, just to help get rid of the infection part of it, and hopefully make him feel better with the pain medication as well.
Poor little thing. He's been scratching and he's got so many problems.
Yeah, it
Poor
happens.
baby.
It happens.
Yeah.
So.
Okay, and if all this goes together, do you know when he could have it? And I gotta see, of course, when
the
they
procedure.
come up with the money.
So just let us know when they come up with the money, because I obviously like to get him done sooner than later. We are booked out a few weeks, so I will say that, but we do get cancellations all the time, and I honestly would put him at the top of the cancellation list, because I'd like to get him fixed sooner than later, just because it is so uncomfortable for him.
Yeah, poor baby.
Just to make him comfy, you know. So.
Okay.
So it may be a few weeks, but we can definitely put him on that cancellation list. And stuff happens all the time where people have to cancel and reschedule. So
I just want to make sure they, because they ask for donations.
Correct.
I want to make sure that the money's there, of course, too.
Yes, absolutely.
I mean, you wouldn't take like 1,000 and wait a few weeks if that happened, would you, or no?
Potentially. I mean, especially if the rescue's involved. I mean, that should be okay. So just let us know. We'll call you, let you know if somebody cancels, and you can call us and let us know whenever you guys have the fundraising part done. So.
Okay, great. Okay,
yeah.
Great. Yeah.
And then as far as he hasn't had he has anesthesia. Has he had anesthesia since you've had him?
Yes, when he was neutered,
That's
he
right.
did in April.
And did okay with that?
Yeah,
Perfect.
Yeah, he did. And that's when she told me his jaw was broken.
Yeah.
Okay. And she goes, I can't do no more. His little jaw's broken and he needs a plate.
No, totally understand. So, as long as everything went okay with that, as far as recovery and all that.
She said no problems.
Perfect.
Yeah.
Okay, cool.
And he's starting to cough a little bit, and I'm not sure. Maybe it's because he's got that infection going down his throat.
It could be. Sometimes little dogs are more prone to either something allergic, obviously, some kind of allergies.
He's got an allergy for everything. Look how pink his skin is.
I know, I noticed that.
And I have him on the flea pill. I have special spray, special shampoo, changed his diet, and now I'm starting to put him on Apoquel.
Yeah.
I've done everything.
It's probably something like a seasonal allergy. They just will get allergens, but instead of them getting, we get like sinus headaches and sinus issues. They get itchy skin. They don't really get as much sinus stuff as we do. They get itchy skin. Even kind of like people with eczema. They are. It's like an allergic reason they get that. Right. And dogs are kind of the same.
And even the grass. I thought it was wet grass, so I carry him to the road every day. Yeah. And we take a walk on the road.
Yeah. And sometimes it is. Sometimes it's something blooming that time of year.
I know.
It's hard because you haven't had him for a full year, so you're close. But so you don't really know, is there any like improvement certain times of the year or not?
Yeah. Well, when I got him in the beginning of March, he was not itchy.
Okay.
Then about a month down the line, he started scratching like crazy, and I said, "What happened?"
Right. Right.
And then I'll never want to do this again, but I did get him a steroid shot.
Yep.
And it worked for 4 months.
Yeah.
Then he started getting itchy again.
Oh my gosh.
So I'm not sure.
It's really hard because sometimes it's stuff in your house. Like sometimes they're allergic to dust mites. I've had dogs allergic to cats, which is hilarious. Like a dog is allergic to a cat, but it's the cat dander,
Yeah.
So it just is really difficult to tell, and it's kind of like ruling stuff out if you can, or trying to find a medication that will. The Apoquel has been a lifesaver because before that we only had steroids, but obviously we'd rather not give them if we don't have to.
Exactly.
Just for the long-term side effects. But I totally understand how it is. Sometimes desperate times,
I guess they hurt it.